COVID vaccine and the booster. Does that take effect immediately?
Well, we're working very hard at the moment with the HSE and the department to come up with the ongoing schedule for the booster programme. Obviously, we got very sobering advice last Friday in terms of Omicron, both in terms of just how much more transmissible it seems to be over Delta, but also very soberingly just how important the booster shot is versus Delta in terms of protection against Omicron. So we were working through a weekend. Obviously, we've been in touch with NIAC as well. We have this additional information. So I wrote to the HSE last night to say please incorporate that into the plan. So there's a lot being worked through at the moment. The most important thing is that we are able to administer as many boosters as possible. We already have the fourth highest booster vaccination rate anywhere in the EU, which is very, very positive. So we're coming from a very strong place, but it's very important to me, very important to others that we go further. And it really is all hands on deck to get as many people boosted as quickly as possible.
And what are the practical things that are being considered to speed up that booster campaign?
We're looking at an awful lot of measures, and I'm bringing an update memo to government this morning on that. So we're looking at how we can support GPs and pharmacists in doing as many boosters as possible, how we can open up the vaccine clinics as much as possible. Can we have more pop-up vaccine centres, for example, looking at options around scheduling, looking at times during the week where there seems to be less demand and times where there's more demand. So really we've been going through a very detailed process with the Department of Health, with the HSE, to make sure we can get as many people boosted as possible. In the meantime, the message to everybody is really stronger now than ever. The emerging evidence we have on Omicron is that it is absolutely essential that people get their boosters, that the additional protection it gives is very, very significant. That without the booster, the protection that the vaccines give us is significantly lower against Omicron than it was against Delta. So really the message is for us all to continue doing what people have been doing so well, working from home unless absolutely necessary, reducing discretionary social contacts if we become symptomatic, to stay at home, get tested. Obviously there's a very big PCR system in place, and then when it is your turn, to get boosted, and there's now multiple avenues to that. So for a lot of people, they'll be contacted by their GP or they'll be contacted by their local vaccine centre, but as well as people will be aware, there's a lot of walk-in options now available through pharmacies and through vaccine centres. So keep checking on the HSE website for that.
And there's a guidance in relation to Omicron.